This is a tutorial on how to properly conduct a sterile catheterization. First things first, and most importantly, we want to ensure that our hands are clean, whether we're using an alcohol-based product or soap and water. The most important aspect of this procedure is to ensure that we maintain sterility and we ensure that everything is as clean as possible. The catheterization packet is pre-made. Day staff cuts the washcloths and night staff puts the packet together. The packet consists of a Chucks pad, povidone iodine swabs. It also consists of the VaPro catheter, a pair of sterile gloves, along with 6 individually cut washcloths that we will be using. And like I mentioned before, the Chucks pad. For this procedure, we will also be using this perineal cleanser to clean the penis before catheterization. Like mentioned before, the most important piece is making sure that we are clean and maintaining sterility. The first step is where we washed our hands. Now we are going to set up our field. So now step 2, we are setting up our field, and we are going to get the Chucks pad and we are going to stretch it out so it's horizontal. And we are going to place the Chucks pad underneath the scrotum. We do this to ensure that if there's any periods of incontinence, the patient does not get any urine on himself, and we are able to have it on the Chucks pad itself. Step 2, we are going to set up our washcloths. Now, everyone does things differently, but what I do is I take each individual washcloth and I fold them into a small square, making 2 piles of 3. Now, once this is complete, you're going to saturate each set of washcloths with water and rinse them out. After you conduct that, you are going to get your perineal spray, and whichever set you're going to use to clean the penis, you're going to spray those 3 washcloths, only 3. As mentioned before, infection control is a major key when conducting this procedure. Now that we're moving on, we want to ensure that when we're cleaning the head of the penis, that we are rotating, whether we're going counterclockwise to clockwise or clockwise to counterclockwise, as demonstrated in this video. Now that the penis is clean, we're going to ensure that our hands are clean by washing our hands with either an alcohol-based solution or soap and water. For the purposes of this video, we are going to pretend that this is the middle of the patient's legs and that this bowl is the middle of his legs where his legs will be together. For this part of the procedure, I open up my povidone iodine. It is perforated for you, so you can just tear it right across. And then I push up the iodine swabs so that when I put my sterile gloves on, I do not contaminate my sterile gloves by touching the outside of the iodine package. I then place the iodine package in between the patient's legs so that is easily accessible when I am cleaning. From there, we are going to take our VaPro and our sterile gloves, and we are going to start creating our sterile field. As I am opening up the gloves, you can tell that I'm being very mindful by making sure that I am not contaminating the inside of my sterile field. Now that I have my sterile field open, I am then going to open up my VaPro. Now it is perforated so that you can open it up seamlessly. I am now going to use the inside of the package of my sterile gloves as my sterile field. And I am going to place and be mindful of where I place the catheter kit. Now we are going to apply our sterile gloves, ensuring that we are not touching the catheter and we are only touching the glove to be able to put the gloves on. Now that we're sterile, we are now able to manipulate the catheter. Now the catheter comes pre-lubricated and it has a paper wrap around it to keep the bag in place. We are going to pull that paper off. Once we pull the paper off, we want to make sure that we inspect the catheter and that the sheath that's around the catheter is intact and there's no tears or rips in it. Now, this green apparatus is what we're going to use to manipulate the catheter when we start our insertion. Here is where we can open up the bag a little bit to make it easier once we start our cath, and we are going to remove this red cap. Now, the catheter has wings on it. These are where you're going to hold the catheter in place when you are doing your insertion. You want to make sure that the catheter itself remains inside of the sheath. You do not want the catheter to come out. You want it to remain inside that plastic sheath because that is what's protecting it. Now we're going to move on to clean the penis with the Providine iodine. As mentioned before, whatever way you decide to go, you want to make sure that you alternate, whether it's counterclockwise to clockwise or clockwise to counterclockwise. One of the key pieces is making sure that you clean the entire head of the penis with the iodine, as shown in the video. Next, we are going to grab our catheter with our sterile hand, ensuring that the catheter remains intact inside of the sheath. We are going to wrap our hands around the penis, as demonstrated in the video, leaving our pointer finger and our thumb so that it can hold on to those wings as explained before. Now that we have placed our fingers on the wings, we can now insert the catheter. We are going to insert the catheter all of the way. As mentioned before, this green apparatus is the only thing we're using to manipulate the catheter because we do not want to rip the sheath. At this point, the catheter is now inside. You should be able to see some urine flowing through the catheter, and you can open up the bag the rest of the way. At this time, you want to make sure that you keep an eye on the bag and that the urine is flowing. If you don't see any urine flowing, this is where you can press on the bladder to see if there's any more urine coming through the catheter. We can begin to remove the catheter a little bit just to see if there's more urine flowing through the bag. If there is no more urine flowing through the bag, we can press on the bladder some more, remove the catheter some more until we get the final result. You want to make sure that you are keeping an eye on the flow. When there is no more urine flowing, you can remove the catheter in its entirety, but make sure that your fingers remain on the wings. When you remove the catheter, you want to make sure you keep the head, the tip of that upward, so that no urine flows out of the catheter itself. There is an area where the catheter says tear here, and it is perforated where you can tear after you look to see how much urine is in there so that you can then discard the urine in the toilet. The final step is ensuring that we clean the penis to make sure that we get any iodine off because it is a skin irritant. And as mentioned previously, you want to make sure that you alternate whether you go counterclockwise to clockwise or clockwise to counterclockwise. Now, this is the conclusion of performing a sterile catheterization. If you have any questions or concerns, please feel free to reach out to management. Thank you for watching the video.